Good morning. I am Anslin, nursing tutor from Emmanuel Arasar College of Nursing. Now we are going to see about mouth care. Oral hygiene is the practice of keeping the mouth clean and healthy by brushing and flossing to prevent tooth decay and gum disease. Aim of mouth care: keep the oral mucosa and lip clean, soft, moist and intact. Remove and prevent the buildup of food debris, dental plaque without damaging the gingiva. Alleviate pain, discomfort, prevent halitosis and freshen the mouth. Maintain oral function, decrease the risk of oral and systematic, increase general well-being. Principles of mouth care: intact mucous membrane serves as the final line of defense of the body against diseases. Pathogen grows well in a warm and moist environment. The greater number of organisms, the greater is the possibility of infection. Pathogenic organism may be transferred from the sources of a new host by direct or indirect method. The skin that is purely nourished and dry has less ability to protect and is more vulnerable to injury. H2O2 acts as anti-infective. Purposes of mouth care: to keep the oral mucosa and lips clean, soft, moist and intact. To alleviate pain, to remove and prevent the buildup of food debris, dental plaque without damaging the gingiva. To prevent infection and dental caries, to prevent infection of salivary gland, to treat a mouth infection, to help maintain and improve patient's appetite, to promote self-esteem and comfort. To prevent complications such as stomatitis, glossitis, pyorrhea, profits, halitosis, etc. To avoid foul breath and foul odor while talking. To educate the patient and family regarding the importance of oral hygiene. Indications of mouth care: unconscious patient, helpless and serious patient, patient with hyperpyrexia, patient with NPO, patient has local disease of the mouth, patient on oxygen inhalation, patient on chemotherapy, malnourished and dehydration patient. A patient who is unable to maintain adequate oral hygiene, patient with hyperpyrexia, malnourished and dehydration patient. Contraindication of mouth care: oral surgery or trauma may contraindicate toothbrushing. Advantages: it helps prevent oral cancer, it helps prevent gum disease, it helps detect dental problems early, it helps maintain good oral health, save money, pressure, breath, whiter teeth. Disadvantages: mouthwash can be dangerous for children when ingested. Mouthwash can damage some part of the mouth, stain and darken teeth, and also irritate canker sores. Solutions used for mouth care: normal saline solution, hydrogen peroxide, potassium permanganate, soda bicarb, thymol solution, lemon juice. Precautions: special precaution for providing oral care according to lifespan. Infant: use a dry gauze to remove accumulated secretion from an infant gums. Use a small soft brush after first teeth have erupted. Child: remember that children younger than 30 years may not understand what rinse or spit means. Don't after them water to rinse with if they are NPO because they will swallow the rinse. Pay special attention to children to ensure removal of food particles from the airway. Older adult: because many older adults wear full or partial dentures, be sure dentures are removed and cleaned regularly. Special dentures cleansers are available. Brush the gums or any remaining teeth well. Procedures of mouth care: equipment: a tray with cover, feeding cup, mouthwash solution, jug of water, kidney tray, gully pot with denture soaking solution, gauze piece with bowl, one artery forceps and one dressing forceps, boroglycerin, one small towel and one small Macintosh, tongue depressor, mouth gag, disposable gloves. Procedure: collect all equipments, bring the tray to the bedside, wash hands and don disposable gloves. Greet the patient and explain the procedure. Maintain proper privacy. Help the patient to sit up in a comfortable position if necessary, supported by the pillows. Place the Macintosh and towel Under the patient face and chin, use artery forceps to clean the tongue, roof of the mouth and lips with gauze and fresh water. Take toothbrush and toothpaste and systemically clean the teeth. Begin on the outside of the patient, brush up and down. Place the kidney tray beside the patient's mouth. Help the patient to rinse the mouth and gargle the throat with clean water. Remove the kidney tray and wipe the patient's mouth and lips. If necessary, apply lubricants. Mouth should be rinsed after every sweet diet. Make the patient comfortable. Remove all equipments from the bedside and replace in the proper place. Wash hands. Record the procedure and observation in patient file. Note the conditions of the patient mouth, tongue, lips and gums and report any abnormalities to the nurse in charge. Thank you.